Are there different types of Asian eyelid surgery? I've been contemplating of getting Asian eyelid surgery done. My grandma recommends that I get the inner corner cut to make my eyes look larger. But I also think I have hooded eyelids. So what procedures would be the best if I want my eyes to become larger and attractive looking?
Thank you for your question. You've submitted 3 photos and you're interested in exploring options about hooded eyes, and you mentioned some interesting advice from a family member as to what to do about making your eyes look larger. So you're asking a question is, are there different types of Asian eyelid surgery? Well, certainly there are. If you look in the plastic surgery literature, you would be impressed by the number of articles that have been written, especially over the past 40 to 50 years, about different methods of Asian eyelid surgery. I will discuss with you my approach, and certainly it does reflect a personal aesthetic and a philosophy, and of course a basis as to why I do things the way I do. I'm a cosmetic oculofacial plastic surgeon specializing in eyelid surgery, and Asian eyelid surgery has been an area of focus in my practice for over 20 years. Now, when I think about Asian eyelid surgery, from the beginning, I followed a basic concept. And this concept is that 50% of people of Asian descent, be it Chinese, Korean, Japanese, the 50% of people have a defined eyelid crease or fold, and 50% do not. Now, in the media of these different countries, there is a lot of emphasis on having big eyes. And this is not necessarily to look Caucasian or non-Asian, but to look as if you naturally have an eyelid crease. And it creates the illusion of the eyes looking more open. Even when the eyes aren't very hooded, when there's a subtle crease, it just looks more open. Now that's of course a personal aesthetic. So when I set out to do eyelid surgery, I always try to perform the procedure in the way as if the person was born with that natural crease. Now, unfortunately, or I should say, there are a lot of people who don't want that and want a more exaggerated appearance. Either they want a very high and deep crease, or they want the eyelids to look wider and look as if they were born a different way. So, in my practice, when I look at a patient who is interested in Asian eyelid surgery, I try to establish with them by doing something simple as using a Q-tip to create a little bit of a fold. And I look at how the eyelid crease forms naturally. If they have a very strong epicanthal fold, it tends to fold naturally into the epicanthal fold. If it's a softer epicanthal fold, then the crease actually goes above it or parallel. And in terms of the outer aspect of the eyelid, it tends to kind of taper outward in a parallel manner. And that seems to be consistently what has been very successful for me in my practice. Now, in making the decision, you asked about the different types of Asian eyelid surgery. I'll break it down into 2 basic categories. One is incisional. Incisional meaning making an incision to enter the skin and to create a connection. Now, whether you do the incisional or non-incisional, the idea is to create a connection between the skin and a muscle called a levator muscle. The levator muscle is the muscle that lifts the eyelid. It's like the word elevator, except without the E. So, with the excisional procedure, we're removing skin, we're removing a little bit of fat to create a connection between the eyelid skin and the levator muscle. In the non-incisional procedure, we actually make little openings, and technically it's still an incision, but it's not a one long incision with several dots that are strategically placed on the eyelid. And those little openings are used to pass a suture to then engage the eyelid skin to the levator muscle, and without doing any stitches on the outside and creating a crease. So how do we make the differentiation and who is a candidate for which procedure? Well, basically I look at whether or not there is extra skin, how cooperative the skin is with making the fold, and whether or not the presence or absence of extra fat that might need to be addressed in order to establish this fold. Now, both procedures have their pros and cons, and each procedure has its risks and benefits. I generally find that younger people with thinner skin which fold easily, I will opt for the non-incisional procedure. Someone's a little bit older, they tend to have a little more extra skin. If someone has much more thicker skin and fat behind, and it doesn't fold in very easily, then I recommend the incisional procedure. Now, as far as other procedures that are related, such as extending the lateral canthus or the outer part, or doing the medial, addressing the epicanthal fold with a procedure called epicanthoplasty, I generally don't recommend those procedures except in cases where the epicanthal fold is so wide and prominent that it actually makes the person look like they're cross-eyed. And those are more, in my practice, the exception than the rule. Generally, what we try to do is create a natural crease that either tapers into the epicanthal fold, and most of the time that's the case in our practice, or a little bit deeper and higher to create a wider eyelid platform and a deeper crease. So I think that you have certainly the opportunity to meet with different doctors who specialize in Asian eyelid surgery and learn more about the options and figure out what you're comfortable with. Certainly, one of the things that I've found very interesting that a lot of people have done before they came to me is they use these little tapes, and these tapes can be applied from right above the eyelashes, and it creates a fold when the skin is easy to fold in. And these patients have brought that tape in and actually shown me exactly where they want their crease. And most of the time I'm actually able to use the tape to mark off where I'm going to place my stitches in order to create the crease that they desire. Once you've met with some qualified, experienced cosmetic surgeons who specialize in Asian eyelid surgery, make the decision that, with the doctor you're comfortable with, and move forward. So I hope that was helpful. I wish you the best of luck, and thank you for your question.